You are watching the TV programs for the United Nations Youth Association of Zambia. Join us as we shape a future that is safe, equal and healthy for all without leaving anyone behind. Today, the United Nations Youth Association of Zambia, through its chapter at the University of Zambia, addresses challenges with regard to sickle cell anemia. Join us as we drive sustainable development and shape our future we want to see.
A lovely good morning to you. Thank you so much for joining us on today's edition of the Q Breakfast Show. It is a lovely Friday. I do hope that you're having a great time this morning. We have a lot to unpack for you on our breakfast show today. All you have to do is sit back and relax. And of course, let's get straight into it. Give us a buzz on Facebook. It is QTV Zambia. Let's get interactive today. And also don't forget that the radio edition is on right now. That is on QFM Africa's Modern Radio 89.1. You can get to tune in and get to listen to some great music and also some great conversations. Now, today we focus on SDG goal number 3, good health and well-being. Now, health-related stigma is increasingly becoming a major public health issue that is receiving more attention, and young adults with sickle cell disease are at risk for health-related stigmatization due to many challenges of the disease. And this morning in the studio, I am joined by Deborah Mulenga Piri, who is a member of Unzayuna, and she is here with me. Good morning, Deborah.
Good morning, Rhoda. How are you doing this
good,
morning?
Thank you. Welcome to our breakfast show today.
Thank you so much for having me here.
All right. So we are talking about stigmatization and human health. Mm-hmm. Now, as we're talking about stigmatization, many people out there would probably not know what this big word means. Just kindly explain what a stigma is.
Okay, so in my words, I'll break down a stigma to some form of discrimination, a discrimination against persons in society that are living with, perceivable characteristics that differentiate them from the normal persons in society. So these are people who are living with probably a characteristic that differentiates them from what the society calls the norm or what society calls normal here.
Now, I have actually heard a lot about sickle cell disease. I think the last time you were here, we did talk about some of the just brief things about sickle cell disease. But I don't really understand what exactly, the details of it are. So what is sickle cell disease and how does it come about?
Well, to start with, sickle cell disease is basically just a red blood disorder. So it's a genetically inherited disease. It's inherited from both parents who may test positive for the sickle cell trait and they may pass it on into a child or children. So when a person or a child is born with sickle cell, meaning both parents have tested positive for the sickle cell trait and passed it on to their child who has tested positive for both traits. I don't know if what I'm saying is making sense. But then it is a red blood disorder in which the red blood cells don't last long, first of all, and they have a crescent form, meaning they're not the normal shape. A normal shape of a red blood cell is spherical, but then these sickle cells have a crescent shape, and they tend to carry lower amounts of oxygen because we know that red blood cells, or if we don't know, the use of red blood cells is to carry oxygen all around the body. So people living with sickle cell anemia tend to have a lower oxygen count because of what their cells are or the shape in which their cells are. Exactly. So apart from having a lower oxygen count, people living with sickle cell anemia or sickle cell disease. Sickle cell anemia is different from sickle cell disease because when one has sickle cell disease, they're prone to have anemia, which is different from the normal iron deficiency anemia. This form of anemia is formed by, the red blood cells not carrying enough amount of oxygen all around the body or not having ample blood in their body. So with sickle cell disease, first of all, people born with sickle cell disease are prone to painful episodes because these cells tend to clump in the blood vessels. They're tiny blood vessels that carry around the red blood cells. So when somebody has a sickle cell crisis, the red blood cells have broken down and have tend to clamp in a specific place. It could be anywhere. It could be fatal if it's, in the head or towards the brain, but then it can be worked on. It's not something that can prove to be, let's say, fatal.
Yeah.
If rushed to the hospital immediately, these people are administered with normal saline drips and painkillers that can help at least reduce the episodes of pain. Yeah.
Now, how does one know that they have sickle cell? Are there any physical signs that you see? Anything that you can tell from?
Basically, when one has sickle cell, first of all, sickle cell is discovered within the first years of life. So by about 5 months thereabout, babies will probably tend to swell. It's a normal thing to swell when somebody has sickle cell. And then they tend to have painful joints.
Yes.
So then parents should be concerned of babies having maybe painful episodes. They're crying because they can't talk, they can't communicate. So when a baby is crying, it's very considerate for parents to take this baby to the hospital to find out if, okay, is my child okay? It's very considerate for parents to do very essential tests on the child. Apart from that, people living with sickle cell live very normal lives, and you can't tell unless they get into what they call a sickle cell crisis, which is a painful episode like I explained before. So their joints tend to swell, and then they usually have yellowish eyes. Yes. Apart from the joints turning swelling, there's usually so much pain like I said before. And basically that in both children and in adults, it's not easy to tell physically, just like it's not easy to tell physically other diseases like cancer, HIV, and all of that. You can't tell just by looking and pointing that this person has, sickle cell. But then you can tell, because you can't really tell, but you can have a clue because they usually have delayed growth. They usually look tinier than the usual and smaller than the usual.
Okay.
Yeah.
So this is not a communicable disease like, COVID-19, HIV, and AIDS?
No, it's not. It can be, it's not airborne, no. It's not sexually transmitted, no. It's genetically inherited. So meaning it comes from a bloodline. It's not something that can just be passed on, no. It has to come from a gene from both parents, which is mother and father, passed on to the child. Yeah.
Okay. Now, kindly share with us some implications that pregnant women go through if they have this disease.
Well, some of the implications from my research that pregnant women would go through when they have the disease is, number one, anemia. They are actually advised to see their doctor more often and to monitor, the levels of blood in their body, because they're not living for themselves, they're carrying somebody in them. So anemia, people living with sickle cell are prone to have higher anemia when they're pregnant. Secondly, people living with sickle cell and are pregnant are prone to have more painful episodes, because pregnancy is just a lot. Yes, they are allowed to get pregnant and they can live a very healthy pregnancy with monitoring from their, specialists, from their healthcare specialists. But then also they are prone to things like miscarriages when not properly monitored, or preeclampsia when they are not properly monitored. Yeah. But then they can live a very healthy life and give birth to actually very healthy babies who may not even have the disease. Yeah.
So is sickle cell, common in both men and women?
Yes. One thing about sickle cell is, just like any other disease, it doesn't choose male, female, rich, poor. So both male and female can have the disease, and depending on how both of these sexes treat the disease, they're able to live a very normal life, first of all. Secondly, in men, it can delay some kind of, growth, especially at puberty. Also in girls, there's delayed growth, especially at puberty. But then this doesn't mean one won't attain puberty. It's something that is, very normal when a patient is not in an episode of pain. So yes, both male and female can have.
Okay. From what you just mentioned, is sickle cell curable? Can it be cured?
Yes, actually, it can be curable, but then curing sickle cell comes at a high risk because it can be curable through stem cells transplant and a bone marrow transplant. Well, stem cells are found in the bone marrow, and these are cells that can, when they grow, they can be turned into anything. They can change into anything. But then the process of having to transplant stem cells or having a bone marrow transplant is what is considered as risky because first of all, you just can't wake up one day and say, okay, I'm going to do this. It has so many health implications, first of all. For a bone marrow transplant, from what I've researched on or from what I've heard, people may need to go through chemotherapy in order for them to have their bone marrow transplant. But then it's not 100% guarantee that it can be curable because it could come back in the future. And after going through all of that process and all of that pain, then it's really not worth it if you're going to still have the disease even after. But there is a guarantee that it can be curable.
Okay.
But not
Now,
100.
okay. So, are there any myths or misconceptions that you would like to clear about sickle cell? Maybe, probably you've heard from people's thoughts.
Well, I have heard a lot of myths and misconceptions actually. To start with, we need to clear out the stigma of it being maybe a spiritual related thing, or rather let me just stop at spiritual there, because others would say, oh no, Alina, my demon, when somebody is having an actual episode of pain. Just because you can't feel it, Rhoda, doesn't mean I'm feeling something else. You get me, right? We don't share the same pain, rather. So if you don't have the disease and I may have the disease, doesn't mean I have demons or doesn't mean I have been bewitched. We need to clear out the ignorance of probably witchcraft, probably, oh, this person will never grow, they've been, they have demons or whatever, and just start to treat this disease as a normal thing that it is with the right steps. If somebody is not fine, you ask them, okay, what is happening? How are you feeling? If they need to be rushed to the hospital, they need to be rushed to the hospital and attended to immediately and given their painkillers. But then the myths of, oh no, this person can have children. Like I said before, it's people with sickle cell have children, very healthy children actually. Also, apart from not having children, they can grow and they can live life up to a certain stage. They can live life even as late as 70, 80, life expectancy. Yeah, just so long as they are taken care of properly and they take care of themselves properly. Yeah.
And what could be the worst case scenario of sickle cell?
Well, the worst case scenario of sickle cell would be one probably having a stroke. I feel like that would be the worst case scenario because when one has a stroke, chances of survival are 50-50. Exactly. So in order to prevent this worst case scenario, apart from having a stroke, there's acute chest syndrome, which is a lung condition, and there's organ damage. Organs in the body may damage because, like we said in the beginning, it's the transportation of red blood cells all around the body which carry oxygen. So if oxygen is not reaching certain parts of the body, they are in a place where they can shatter. They are at risk of shattering and being damaged. So the worst case scenario, like I said, would probably be having a stroke because we know this person has 50-50 chances of survival. And so at age, all those parents, maybe guardians, or just adults living with sickle cell anemia to pay extra attention to themselves and not reach to a point where they may have the worst case scenario. How? Whenever you're in any form of pain or you feel anything, please be sure to take your painkillers. Be sure to see your doctor and explain to them how you're feeling. Apart from that, be sure to stay away from places where you could catch infections. I know we can't see infections visibly, but then be sure to take care of yourself. Wash your hands, just be in a clean and safe environment also, so that you're not prone to all these worst case scenarios. Take a lot of water, keep yourselves warm when it's very cold, stay very hydrated when it's very, very hot. Yeah.
Now, how is sickle cell managed? Is there anything that patients are required to do? You know, a certain lifestyle that they're required to live?
Well, yes, actually, there is a certain lifestyle sickle cell disease patients are required to live. To start with, sickle cell disease patients are required to live a life that's not very stressful because stress can trigger a crisis. First of all, stress, fatigue can trigger a crisis. Also, to stay away from very strenuous exercises because strenuous exercises can make one dehydrated, and once one is dehydrated, it may lead to a painful crisis. Also, apart from strenuous exercises, sickle cell disease patients are advised actually to stay away from taking alcohol and smoking because taking alcohol dehydrates the body, and in the body we need so much water and just so much. The body just needs to be hydrated in order for it to function. Apart from that, people living with sickle cell just need to, stay away from stress. Like I said stay away from stress. I said stay away from alcohol. I said stay away from strenuous exercises. Hydrate themselves and keep warm when it's cold, and stay away from places that have low oxygen. I know we're living in times where there's COVID. These are people who are at risk of getting COVID also. No one is exceptional. But then when you're in public, please remember to mask up if you have this disease, just to stay away from catching infections. Apart from that, remember to be in places where there's ample oxygen because there's not much oxygen flowing around the body. So you need to be in a place where there's enough oxygen circulation to avoid a crisis. Yes.
Okay. Any last words to the viewers in terms of what we have been talking about today?
Well, my last words to the viewers would be, first of all, sickle cell disease is not a death sentence, rather. It's something that, like I said, it's something that can be lived with. It's something that people do live with. It's something that even successful people have lived with. It doesn't mean you are exceptional from the society and you cannot work, you cannot do anything because you have the disease. Rather, you can try and live life in the right aspects and try and work for yourselves and achieve things. Just because you're in so many painful episodes of a crisis doesn't mean you can't work. You can actually go to school, you can learn, you can pass. I've heard of people who've actually done so well and are willing to help. So yeah, those are my words of encouragement, are basically just to be strong and just be who you are and just follow your purpose, because there's a reason why we are on this earth, and there's a reason why even if you have that disease, you are not dead and you are alive. You better follow that purpose that was put in you.
Absolutely. Thank you so much, Deborah, for coming through to our breakfast show.
Thank you so much, Rhoda, for having me today.
All right, so we do continue with our breakfast show. Stick around. We'll be back shortly with more.